Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the types or classification of tracheoesophageal fistula. Right. In the classification of tracheoesophageal fistula, we have these types. Okay. First, we have atresia only. In atresia only, there is no fistula. There is just atresia of the esophagus is present. So this is the trachea. Trachea is normal, but there is atresia of esophagus is seen in atresia only. Whereas atresia with proximal tracheoesophageal fistula, here there is proximal tracheoesophageal fistula is present. So actually this is the trachea, right? So here there is proximal tracheoesophageal fistula is present with distal uh, atresia. So there is distal esophageal atresia is present and proximal tracheoesophageal fistula is present. Then second type, atresia with distal tracheoesophageal fistula. So this is trachea, here there is atresia and there is distal tracheoesophageal fistula is seen. So there is proximal esophageal atresia with distal tracheoesophageal fistula is seen. Then here there is atresia with both proximal. So this is the normal trachea. Okay, this here there is both proximal tracheoesophageal fistula is present and there is even the distal tracheoesophageal fistula is present. So this is actually a H shape of tracheoesophageal fistula is seen. So this is type 4. Then type 5, there is only tracheoesophageal fistula is seen. Actually it is like this, there is proximal tracheoesophageal fistula and there is also distal tracheoesophageal fistula is also seen. Okay, something like this. So there is proximal tracheoesophageal fistula and distal tracheoesophageal fistula is also seen in this one. Proximal tracheoesophageal fistula and distal tracheoesophageal fistula. Here there is only tracheoesophageal fistula, which is H type. This is trachea. Okay. So these are the classification of tracheoesophageal fistula. Out of this type, which is atresia, proximal tracheoesophageal atresia with distal tracheoesophageal fistula is the most common type.
thank you and thank you for watching.